So, I'm sorry, this is the glucometer. Has anyone used this for your relatives or siblings or in yourself for taking your glucose? Your mom? Okay. So all of them have different companies. This one is made by Abbott. Abbott is a very popular company that does a lot of laboratory devices. This is considered a lab device. This is also considered a lab device. And the reason why it's called point of care testing is because instead of taking blood from a phlebotomist, then sending it down to the laboratory, you're taking this device to the patient. So I'm personally going to Multizem's bedside or on the surgery bed and then taking her glucose. So this is point of care. The information can be uploaded here. I can scan her patient medical record number badge, and then her name will populate. And then the way this works is, in order for you to be able to run this, we could do it at home ourselves and even to our family members. But when you're using a device in the hospital, because it's under the hospital umbrella, you have to be licensed to be able to operate this device. This, you'll have to be signed off on competency to use a glucometer. So just because you do it at home doesn't necessarily mean that you can do it inside the hospital.
Are we certified to do it?
So right now, we just actually got this when we opened the new hospital. So we don't have the anesthesia techs trained on the glucometer. Eventually, I might have them do it. But right now, like the anesthesiologists, they have to get renew their competencies every year, and they do very bad with that. They don't go when they're supposed to, and then they question. Like I got a phone call during class one time. The charge nurse called to Diane, we had an issue with the glucometer. I said it wasn't working for them. I said, well, he goes, he couldn't log in. I said, well, that's because if you don't renew your competency and you don't get updated, then you're not going to be able to log in. They lock you out. And so in order for you to be able to use this, you have to have your credentials, usually like a 4-digit number, and then you're able to take the test on the patient. So, let's see. So this is battery operated. This is called a, last upload is incomplete. So they want you to redock this glucometer. You do a patient test and a control test. The control test means in order for you to calibrate and make sure you get accurate readings, you run a control. Just like when you've done your lab, your science labs, you have a control, and then you have your baseline, and then you have your actual, your other. You have one control, and then you have your actual test. And so the control is basically used to make sure that you have accurate readings. So this is the control solution. You choose if you want to do a patient test or a control test. I'm not going to be able to get in here because I don't have a fake patient name. And we don't want this obviously to go to a real patient's chart. But you can choose patient test or control test. And then it's going to ask you for a 5-digit, 1, 2, 3, 4, 6-digit operator ID. And then when you enter an operator ID, then they'll be able to upload a strip. So this is the prick. This is the prick where they take this, and usually you want to get good blood flow. Typically diabetics, they get pricked in the same place, and after a while it hurts, and after a while you kind of have to choose a different finger. I like to go for the thumb because there's more blood flow there, but it could be different for diabetics, right? It could be really like chafed, and it's just very hard to prick, and after a while the skin becomes hard. So you want to massage the thumb or the finger, and you want to have it go diagonal, and then once and then once you kind of able to massage it, you're able to take this and then you're going to prick the skin. Okay. Once you prick the skin, it's been a while since I did this.
Does it hurt?
What?
The prick?
Oh, I didn't prick myself. I pricked the patient.
Let's test it on.
Yeah, mine right on.
What is prick thing that you don't prick your hand? What's it called?
What is it called?
Yeah.
I honestly don't remember what it's called.
Does it say on the packaging?
No, it's the needle.
We got a whole ring smelling iron now.
Is that it?
It's called the
The
needle.
ring smelled like blood. Like the one we do. Smells like. Yeah, we do.
This
is a little weird.
Yeah, let me, I forget what it's called. I'll get you the name. So once you get the blood, you insert this into the machine, okay? And then you actually get your blood sample and you want to fill up the white line. If you don't get enough blood, you're not going to get a reading. You want to fill the blood up into the white line. That's the whole reason of why you're getting a needle.
That's little though. Oh God.
But when you're trying to pull blood from a diabetic patient, sometimes it's even hard to get blood off of their finger. So the way it works is you get the alcohol. You want to do this to the skin, right?
What's the purpose of this? What's the goal?
Check your blood sugar.
Glucometer.
Glucometer, glucometer, glucose meter. You want to check the glucose level of the blood glucose of the patient, the sugar. And then once you get that needle, you prick it. You hear a pop, like click, right? I'm not going to do it on myself. And then once I get it, right where the circle of the blood is, I'll just fill up that white line. Okay. And then once I'm able to do that, this machine is different. You see these three black lines? I'm going to put it in here, and it'll give me a numerical value. Okay? The numerical value, typically anything under 100, I think milliliters is considered 100. Under 100 for your blood sugar is considered normal. Anything over 100 is considered, the person is pre-diabetic, potentially pre-diabetic. But in order for you to be pre-diabetic, you have to have had that number. You know, you could have just ate a candy bar and your number is really high, but when you're fasting, like a fasting glucose test, you're probably in the normal range. You typically don't want to take your test after you eat because your sugar will be very high. If I were to have had a quad shot coffee with creamer, my number would be high.
So what's the number for when you're truly diabetic? Like,
Let me get the number, the range for you, but I think it's like 120 to 150, and then the based on how much their blood sugar is, there's usually already a doctor's order of how many units of either like the dose of their oral pills or the dose or how many units of insulin they have to inject themselves with. And My mother used to take oral pills, and then because she's like non-compliant and she's always hiding candy in her bag or chocolate and M&Ms, she's now on insulin, and she doesn't like needles. So she tells me, she admits that if she's supposed to give herself 20 units of insulin, she'll only give herself 10 because she doesn't like needles.
Don't they have things now that like patches that they can leave on 24 hours that give insulin?
Like an insulin pump or something like that?
Yeah.
Oh, I don't know. Yeah,
I thought they were coming out with some new good stuff.
I haven't seen it, but yeah, and then sometimes they'll have to inject themselves, usually in like a fatty area, and then they'll inject that dose. And you could do that at home, but you can't do that here. You can't just do that on any patient here. So this is the reason. This is the purpose of having this. And the reason why is we have obviously patients that are having surgery that could be diabetic, or it could be the fluids or solutions they're giving the patient. And some of this has sugar in it, like dextrose has sugar in it. We want to monitor the levels of sugar and also monitor if there's any effect with their blood sugar. And so that's the reason why we have this. The other option you could use is the iStat. So for many years we did not have these two boxes. We only had this AC2 box. So now we have 3 options of boxes. So how do you know what box does what? And so like as you saw earlier, I kept telling, I told Quinn, put the box there, and we took it back away. And I said, no, put the box back there, because you took it back away. They're all different colors. There's a dark blue, there's a light blue, and then there's an orange.
Specific tests.
Yes,
Specific, yeah.
they all do something different. And so this one is called ACT.
What that be?
I'm sorry?
What that be?
What that be?
What that be?
What this does is called activated clotting time. Okay. Activated. So let's all of you. Can you guys put your gloves on? Because we're going to be touching a lot of things. What's tomorrow? 13? This is going to expire on Monday. We're closed. Tomorrow's Friday, right?
Yeah. Is this part added as well?
Yes.
Can we open it?
Yes. Glucometer. So go ahead and open it.
So it says 35 to 45 degrees Fahrenheit.
So after you take it from the fridge, that's when it goes in.
And you're storing it in the fridge, that's what the temp it wants, 35 and 45?
No, it says 46. Yeah, 35 degrees to 46 degrees Fahrenheit. Or in Celsius is 2 degrees to 8 degrees Celsius. So that is a Joint Commission question. So if they were to stop you in the workroom, they're going to ask you, what is the range of your refrigerator where you store your point of care testing instruments and supplies? The answer would be 2 to 8 degrees centigrade. Please keep in mind that when you are referring to temperature, it's always in centigrade or Celsius. And so,
2 to 8, 2 to 8, 2 to 8, 2 to 8.
2 to 8 centigrade.
Or 35.
And so then it also shows 64 to 86 Fahrenheit or 18 Celsius to 30. So what's the significance of that?
Oh, that is after you take it all out of the refrigerator. Okay. So this is what happens. We have so many boxes out of the refrigerator because the refrigerator was out of range. So once it is out of range, the boxes can no longer be kept in the refrigerator. This extends the duration of the cartridge to the length of the expiration date of the actual cartridge. Okay, so if we had left this in the refrigerator, this will be good until 12/8/2020. But because it's out of the refrigerator, you have to write down the date, 14 days from the time that you took it out. So if today's the 12th, I'm gonna add 14, then it'll be 26. So 11/26, I use this out. This is good until November 26th, and then I have to throw it away. So you have your temperature range, you have the expiration date. You have to read it because everything is different. This one is 2 months, and it has a big number 2, but it says M for months. This one is 14. Did you get one? Yeah. Okay. And it says D for days. So 2 months, 14 days.
What was that 2 months for?
CG8. So before you crack this open, you have the expiration date, you have a lot number, and you have the expiration date of the cartridge, and then you have the duration of time it's good for once you take it out of the refrigerator. Why do you need this? Is because when you activate this machine, they will, the anesthesiologist will again put their operator ID, and then they will go ahead and scan. They can scan the armband of the patient, which has their barcode on it, and then they're going to scan the cartridge so that the machine knows what cartridge are you using and what tests are you going to perform. So you use that barcode that's on the wrapper of the cartridge. And the reason why too is that if there's any recall or any defect on the results, you want to be able to identify what cartridge did you use on that patient. So the lot number is there, so it tells you what lot number is. Then it shows you the expiration date. Okay, and then the number of days it's good for. Once you take it out of the refrigerator, if you already took it out of the refrigerator, and let's say, John, you took it out today, then you're gonna write here 11/26/2020. And then you could leave it out here by the workroom, and then so the staff will check before they bring it into the room. So this is almost like a little disc when you open it, okay? And then what ends up happening is you're going to inject, blood. Where would they get the blood from?
Aerial one. One of the lines on the patient.
On the line. Hi, Alan. Hi, hello. Are you familiar with the Y connection?
Yeah.
Is it on any one of the main? No, the 24. I don't have to look over here, but is that for the 24?
Yeah, that's not the right connection though, it is in use.
It's me?
Yeah.
Do you have the middle? Oh. Well, do you have more, is that the only one you have left, or do you have more?
I think it's more.
Huh?